Today is the 41st day of my training in the Doctor Blum clinic here in Spain. A lot has happened during these last few weeks. We started with a few sets of resistance exercises for the muscles of my hips, pelvis and back. My lower back and my pelvic muscles are extremely weak, so when we first managed to make them respond, it was very difficult and tiring for me. At first, the device that I found most difficult was the roll drum. That's a nickname that we use here in the clinic for the device that makes your innermost vertebral muscles work from top to bottom. I trained my superficial back muscles in the past for several years, which allowed me to hold myself in sitting without the use of my arms. But I was shocked to discover how weak are my deep back muscles. I had troubles bending even with the minimal resistance exercise follow-up. The devices of Professor Blum allowed the precise control of my resistance, and so I couldn't switch to my stronger muscles and had no other way but to switch on the weakened deep ones. Oh, that was difficult. I had lots of muscular soreness in my back, and I even several episodes of fevers. But as the doctor said, indeed, gradually my deeper muscles of the spine started to respond, and I started to feel the way how they can resist and switch on. At the next stage, we added the compression devices that Professor developed. They are designed to do a first step of providing a diffuse intensification of the blood circulation and what the doctor calls an interstitial flow rate, improvement in my pelvic region and my upper thighs, before we will shift to the next phase of actually trying to switch on my muscles in those regions. What are the results today? Visually, it's clear that my right leg is somewhat ahead of my left one, my worst side. I had all sorts of swelling that came and went. First it was my lower leg, then it was my upper thigh. After 10 days, the lower one was no longer swelling, but the upper one was going through ups and downs. One day it would swell and the other day it would contract and look collapsed. But now, after several weeks of work, I'd say that it feels workable. Now it is the 41st day of my training here, and I feel that my muscles, even in the left leg, are beginning to feel more alive. It started with the pelvic region, my buttocks, and then descended lower down to my thigh. It's hard to say how quickly will everything work. I understand that every case is individual, but I can definitely see that there are a lot of intense processes of livening up going on, even in my worst left leg. The moment there is some activation, when I can feel myself that some glued muscles separate and free up, my fever really spikes up. It swells, but then within a couple of days it all goes back to normal. In short, by today the loads that I get now here, I consider them as intense training and not as the unbearable suffering and instant exhaustion that I felt in the beginning. Today it feels like an intense training that we need to do correctly and really precisely in order to switch the exact muscle groups that we are interested in waking up. In the beginning, that was like a fight for survival. I couldn't do any precise movement. I just resisted as much as I could somewhere around the area that I was asked about. My muscles couldn't do any better than that. I didn't feel them, and I didn't understand where and how they were working. Today it is different. I feel my muscles working in different modes, and I'm gaining more and more control on how they resist and activate. I can't see my own back, but my father said that it looks very different now, comparing to how it looked before I came here. He says that below the surgery level, it used to look flat as a frying pan. Now, after just 40 days of training, he can see my back muscles that are contracting and expanding when working. I'm planning to get back here on February 8th. The next stage of the program that the doctor is planning for me here is to start integrating those muscular improvements that we have already achieved into the integrated work of my awakened muscles with the functional goals in mind. That's the next step, and then we'll see. I'm taking everything on a step-by-step basis.